Oi. Hello. Good afternoon to everybody. We are starting this session. We have with us Emily Darlington. She will speak about developing co-creation practices in health promotion, an attempt and definition, and specific competencies. We are very pleased to have Emily Darlington. She has a permanent position as an associate professor at Claude Lyon 1 University in France. She is a co-leader for the Pathway Systematic Interaction Teams at the Health Systemic Process Research Unit. Her research in the field of system thinking applied to health promotion mainly focused on the design, implementation, and evaluation of health promotion projects, particularly in school settings. She has recently developed an interest in the implementation of high-level participation modes, such as co-creation, and which are one of the pillars of the Health Promoting Schools framework. She is a board member of UniRes Network, which is a network of universities for education and health promotion in France, and a steering member for the Schools for Health in Europe research group. She is also co-convener for the ERA Network 8 Health Education. So we have with us Emily Darlington. We have been working for several years now. By the way, my name is Graça Simões Carvalho. I am from the University of Minho in Portugal, located in Braga city. And as I said before, we have here my friend Emily Darlington, my friend, my colleague, and you'll see that she will present something very interesting to all of us in this Congress. Thank you, Emily. The microphone and the floor is yours. Thank you.
Thanks a lot, Graça. I'm very happy to be with you all today, and especially with you, Graça. As you said, we've been working together for a long time, and this interest in co-creation is shared with you. So I'm very, very happy to be presenting this work with you, chairing this session. Can you see my slide?
Yes,
okay?
Yes.
Yeah.
It's
okay.
Perfect. Thank you.
Super. Okay. So for this talk, which focuses on co-creation, these are the three main points I want to focus on for today. The why focus and work on co-creation in the field of health promotion. Why is it important? The second point is what does it mean? And the third point is how to develop practices and co-creation. So just to introduce my talk, I would like to go back to what the field of health promotion is, as I'm not sure if you're familiar with this field of practice and research. So basically, health promotion is the process of enabling people to increase control over their own health and to improve it. And the way practitioners and researchers have been attempting to develop this field is to focus on three main strategies, which are, and you can see the three pillars in this model: protection, which is working on policy, environment, whether it's physical or social environments. Also prevention, which aims to reduce the impact of risk factors on health. And finally, health education, which aims to develop health literacy, which is knowledge, understanding messages, being able to put in practice competencies as well, autonomy, and also to develop life skills so that people can make the best choices for themselves. And to this effect, programs and interventions have been developed over the years. However, one of the issues relating to program implementation is that programs cannot be limited to a plug-and-play process. And depending on the context, the program and the development stage of the process, and of course, depending on professionals who often cope with a lot of stimulations and programs and interventions that need to be implemented, what actually happens is often very different from what had been expected or planned beforehand. And other challenges with research, which researchers and practitioners have been faced with over the years in the field of health promotion is how to ensure that what we propose actually best fits and addresses actual needs of citizens and people. How can health promotion initiatives and programs be sustainable? And also, this points to the development of people's capacity skills rather than continuing to impose projects from outside of people's living environments. And a potential strategy to address this has been to focus on citizen engagement and participation. And going back to the field of health promotion, the Jakarta Declaration, which is one of the core texts in this field, emphasizes 5 priorities, among which to promote social responsibility, to promote citizen participation and shared decision-making processes. And as other authors point out, such as Heritage and Doris, not only is citizen engagement key for health promotion, but it is also key to develop healthy cities and sustainable social, environmental, and economic development. And this all contributes to promoting people's health. And in the recent COVID-19 pandemic, I think this pandemic has shown the importance of participatory approaches in health promotion, in the measures that we impose people to enhance the uptake and adhesion to policy level strategies, as if people don't understand a policy, they will not tend to apply it. But when we talk about participation, the first thing that comes to mind is, what does it actually mean? And the World Health Organization puts forward the following definition of what participation means. And it's a process by which people are enabled to become actively and genuinely involved in defining the issues of concern to them, in making decisions about factors that affect their lives, in formulating and implementing policies, and also in planning and developing and delivering services, and in taking action to achieve change. And that, may I say, is quite an ambitious program, really, when you think about it. And of course, improving citizen stakeholder participation is crucial at many levels of implementation and program development. And it starts with the policies, and the policies have to frame practices need to take into account and be tailored to local needs, which means giving stakeholders a voice. And as Ilona Kickbush points out, and she's one of the main figures of the field of health promotion, she says that governance for health must be participatory and include, but go beyond expert opinion. And another example is Janssen and colleagues, and they emphasize the fact that citizen coherence and cooperation between policy, research, and practice in public health on local level. National levels of policy in health promotion really do need to take into account the needs of local level policy and practice. And it's the same at a community level, community capacity building, which develops skills, knowledge, stakeholder and community members' leadership, participation and power is documented to improve the outcomes of health promotion programs. And Laverack points out that problem assessment, for example, and increased analytical skills are definite levers. And when we think about school-based health promotion, which is also something we work with a lot, when stakeholders participate actively in the first phases of program design, then the program will be more efficient and sustainable. And as I said, and Graça said in the introduction, higher levels of participation are both an aim and an enabling process for health promoting schools. And this is a framework we work with a lot because we know that health starts very early and health inequities start very early in life, and we need to target health determinants. And school plays a very important role. And the health promoting schools framework, which is a framework based on the whole school, puts the pupil in at the very center of anything that concerns them. And participation is one of the key aspects to this framework. And the endeavor to use a whole school approach and to engage with people in relation to the matters which concern them is beneficial, and it emphasizes the beneficial roles of stakeholders and strengthen relations with the surrounding community, and basically giving pupils a voice in decision-making process is both a means and an end as part of democratic school health promotion. It's also a way to enhance educational outcomes by means of engaging pupils as experts of their own learning. But really, once this is said, how can we decide whether participation is active and genuine, and what does active and genuine participation actually mean? Does true, genuine participation imply specific means for sharing knowledge? Does it mean making decisions and collaborating? Does it depend on the status of the participants? That is to say, on whether they're considered as citizens, stakeholders, users of a service, beneficiaries, and how can we promote participation? Basically, what I'm saying is, how can we ensure that citizen stakeholders, children's participation is not what you can find in the literature as tokenistic participation, which means fake participation? How can we ensure that when we talk about participation, it's a high level of participation and not information? Well, in searches for ways to support high levels of participation, we came across and started working on the concept of co-creation. And I'm saying we, I'm referring to my fellow health promotion research colleagues. And this concept was at first quite new to me. And after some green, white, and grey literature search, we found that in recent years, this concept has been used alongside concepts of empowerment, participation, engagement, and citizenship to mirror the drive to involve citizens in decision-making processes. And the use of co-creation in education builds on the vision that education must pursue and contribute to social justice by reducing inequality. And this starts with concern for power distribution and the redistribution of power in classrooms. But co-creation may also be seen as an end in health promotion, because it's the process of enabling people to increase control over and to improve their own health, as I said in my introduction. And in 2018, Bjarne Brun Jensen, the European Vice President of the International Union for Health Promotion and Education, did make an encompassing case for co-creation, arguing that it would contribute to taking health promotion forward towards its 2.0 version. But in his talk, Bjarne Brun Jensen suggested that co-creation could be something to move the field forward, but didn't give any leads as to actually how to do it. So this is one of the reasons why we decided to work with co-creation with a consortium of universities, and I will present those later in my talk. So just to sum everything up, could co-creation be a way to increase citizen participation? This is basically the hypothesis where we started working with from the beginning. And I'll just quote Torfing and colleagues who define co-creation as a shared process of problem formulation and problem solving. And this points to anticipated benefits of co-creation, including social cohesion, democratic participation, as well as the design of more effective and relevant solutions to increasingly complex societal problems. And this is basically the exact gap that we were trying to address in the first place when I presented the issues that we're faced with in the field of health promotion. But with co-creation, the same problem as with participation comes up. And one of the major challenges which needs to be confronted when working with co-creation is to define it and to know exactly what it means. And what we found when we started looking at the literature was that definitions of co-creation exist within different professional disciplines. However, these understandings do vary quite a lot depending on the professional field. And with respect to health promotion, to our knowledge, there's no consensual definition of what co-creation is. Beauvert and Loeffler, who have worked a lot on co-creation, point out that definitions of co-creation variously embrace the characteristics of the relationship between stakeholders, also their joint activities, and their joint achievements. And Torfing highlights how the term co-creation and co-production are sometimes used interchangeably. In the field of education, for example, terms of as collaboration, partnership, student voice, student as partners, co-creation, students as agents, student as producers can be found, and they can be found to carry different meanings. In the published literature, yet other terms can be found, and maybe you've come across them when reading project reports and also scientific articles. So you can find co-design, co-planning, co-managing, co-delivery, co-construction, co-innovation, amongst others, and which makes co-creation an even more difficult concept to define. So the term co-creation is used inconsistently and it carries different meanings. And these different meanings wouldn't matter so much if they didn't refer to different types of participation and levels of participation, which can range from consultation to actual partnership and collaboration. But this is not the same thing. consultation, information, very low levels of participation, whereas partnership, collaboration, and shared decision-making power are totally different modes of collaborating. And this lack of clear guideline and guidance on how to define co-creation and then thus how to promote co-creation leads to many different kinds of participatory practices. And in the worst case scenario, so-called co-creation could even be perceived to mean consultation or information, which would potentially set the grounds for what I was referring to earlier as tokenistic participation, fake participation. So what we first did in this context was to try and understand how professionals actually define it and how co-creation is defined basically by its users, the professionals who practice co-creation, who want to practice co-creation in the field of health promotion. And I've said before that one of the aims is to enable capacity building and autonomy in people. So co-creation could really be something that you would be looking for in health promotion. So the first step was to try and define co-creation and try also and identify some potential specificities of co-creation in the field of health promotion, as opposed to other professional fields, which could define it differently, and also identify some barriers and levers as to how to practice co-creation and how to include it in daily health promotion practice. So at this point, we were taking part in a European project called Co-Creating Welfare. And this European project was about promoting co-creation practices and using a training program that we had designed based on creative thinking activities and workshops to enable professionals to move forward in their co-creation practices. So this first research was carried out as an offshoot of the project, not directly within the project, because we didn't, that wasn't the aim, the initial aim, but we saw the creative thinking activities and workshops as an opportunity to collect data. And we collected documents and pictures throughout all the workshops that we did. And we were focusing on health promotion professionals because these are the professionals we work with most. And most of them were based in schools, but not only. So we gave them activities and focused together on their definition of co-creation, the incentives to use co-creation, which means the reasons why they would want to use co-creation, the benefits that they saw in using co-creation, the levers and difficulties they could be faced with relating to the use of co-creative processes in their practice. And then we analyzed the data together with each group, and basically our role as researchers was more a facilitating role than an external evaluator, if I may put it like this. The group analyzed and categorized the data by themselves, and we used a participatory research approach to do this. So the first finding that I found a little bit surprising, really, was that when we asked them how they felt about co-creation, professional expressed positive feelings of excitement, motivation, interest, and curiosity, but also negative feelings. And I have to say, I wasn't expecting that. But they thought it was quite destabilizing. They felt uneasy because it was different or unknown, and they had doubts as to whether to do it or not. And that was, to me, as I said, a little bit surprising. I was expecting something very positive and only positive, and it wasn't that way. They were quite perplexed. They thought it was quite vague, and they were starting to question the relevance of using co-creation. So then we moved on to who is involved in co-creation and creative co-created processes. And the group of professionals came up with the fact that it involves a group of people who come together on a voluntary basis. And the way we name them is very important, because if we use terms like users or beneficiaries, this points to some kind of asymmetrical relationship between the provider of a service, or the professional who would be the expert, and the user of the service who would be the recipient of something. And this is not in the idea of what co-creation is. So we discussed a lot about how to name these the people who took part in the process. And they also pointed to the fact that it brings together a variety of people, and that we need to take into account the different backgrounds, and that is very rich, and that is what is wanted in co-creative processes. And they have to come together in a friendly way, and they have to know and acknowledge that they need to work with their own differences, and that their collaboration is based on a set of values. And initially, we asked them to write their own definition of co-creation, and we did a word cloud with it. And what came out straight up was the creation of something. But that really does mean something when you talk about projects and implementing health promotion projects. The idea behind co-creation was to create something new. And create something new together with the people, and they have to have something in common. But the word different comes out here because they explained during their discussions again that the group of people involved in the co-creation processes came from different backgrounds, and this was one of the reasons why they could create something new together. But one of the conditions would be that they share something. And also, something was very important was that there was specific values that co-creation is embedded with and those were respecting differences, respecting different professional backgrounds, probably different hierarchy or different positions, different social statuses, etc. And trust also, and that everyone is involved in the process. Everyone has responsibility, takes responsibility. And of course, this is based on freedom and voluntary based. And it's a process of sharing and transformation. This was something that came up very strongly. So we discussed with them quite a while and we did workshops with many professionals and came up with a definition which encompassed all the discussions that we had in the different groups and workshops. And based on our findings, we found that it's a process. Co-creation is a process that would seem to involve a team of people formed on a voluntary basis, recognizing that they have something in common, as I've just said. So as we didn't know what to call these people and professionals, we decided to call them co-creators, because we wanted to point to horizontal power, and everybody would be a co-creator. So co-creators come from different backgrounds, as I said before, and each of them is recognized as a legitimate and has a legitimate place within the group. And to be co-creative, the group must recognize everyone's place and competence. The co-creators have a common interest to create something together for the benefit of the larger whole. And interactions between co-creators should be based on cohesion, and collaboration should be based on mutual trust, openness, autonomy, freedom, respect, democratic processes, and shared responsibility. Co-creators should share ideas equally and freely to mutualize knowledge and promote innovation, because the result of the process would be innovation, creating something new. Differences between co-creators, whether in terms of background, culture, or professional identity, are embraced and transformed into opportunities for creativity, novelty, and connection. Co-creation is a process which includes communication, a compromise, collective reflection, and, as I said, horizontal decision-making, and the co-creation, the creation of a shared culture. Equal value is given to the knowledge, competence, action, and decision power of each member in the group, and the shared culture between co-creators is a prerequisite and a result. Co-creation results in a joint creation of a new project or action, or a joint decision, or the improvement of existing projects and practices, all of which are useful and tailored to existing needs, and that's very important, and will contribute to promoting health and well-being. And this co-creation process benefits members of the group by enabling them to gain new experiences, competencies also, skills, and strengthen networks and social relations between them. This process of co-creation benefits the whole community as it promotes the effectiveness of health promotion actions and projects, and also it enriches networks and successful living together. So basically, the definition the professionals came up with was this: for health promoters, co-creation is it's a summary of what I've just said, a voluntary-based process of bottom-up collaboration based on values of diversity, mutual trust, openness, autonomy, freedom, and respect, together with shared expertise, responsibility, and decision-making. Co-creation results in new or improved tailored health promoting practices and projects which address a co-defined need for the benefit and increased power of each member of the group. So from what professional told us, specific competencies are needed to promote co-creation, such as, and they listed active listening, mediation competencies, also stepping out of one's comfort zone, reflexivity, and thinking outside the box. So we decided that we wanted to know more and started to ask ourselves the question of what is needed to develop co-creation practices. And when thinking of the methods to promote co-creation processes, well, major challenges are ahead of us. From the literature, we know that it's difficult to collaborate between different professional sectors, and that alone is a challenge. And when we look at practices, it's often the case that, as I said before, so-called high levels of participation involve information rather than consultation. And in the case of school-based health promotion, this is particularly the case with parents, for example, who are often involved at later stages of project design and strategic development. And if we look at the barriers to higher levels of participation, and well, these barriers include different perceptions of the stakes, the different incentives to collaborate, differences in conceptions of the objectives of the intervention or project, and also different perceptions on how to define high levels of participation. And also other issues relate to professional identity and purpose, beliefs, and related complex power dynamics. And one of them is to be willing to let go of an expert position, and that's not always easy for professionals. And claiming to use co-creation is not necessarily a guarantee that power is redistributed. But we based our further research on the argument that professionals do have the power to support the development of community capacity and strengthen citizen participation. And as I said in my introduction, this is one of the core leads for action in the field of health promotion. So professionals have the potential to support the development of skills in the community and also knowledge, but they need specific competencies to do so. And being able to apply these community skills is important for translating policy, theory, and research into actionable and usable health promotion and practices. So some of the core competencies needed to catalyze change in communities and develop leadership and building partnerships. But the issue of what professional competencies are needed to promote co-creative processes underpinned by partnership and collaboration and not tokenistic consultation still need to be identified. So this is where the second phase of our research comes in. And this second phase of research on co-creation draws from the assumption that professional competency is constructed during professional activity. And such activity, which takes place in a social context, includes the motivation of professionals and social values and the results they expect from carrying out their task. And to some extent, professional competency can be viewed as a capacity to adapt to new situations and solve complex problems. So what did we do and how did we do it? Well, this time we carried out this research during the course of the co-creating welfare project, and there were different countries involved. Denmark with the University College Lillebælt and the South Denmark European Office. We also worked with Coventry University, University of Lyon is us, and University of Minho, and Graça here present and her team also contributed to this research. So how did we do it? Well, again, we tried to practice what we preach and we asked professionals. And the professionals identified some competencies that they thought were key to support co-creation processes and in their own community. And I've made here a list of such competencies, and to sum up and be quite brief, there were some communication skills. Also, being able to shift and from their own point of view and listen to other people's views and opinion. Be humble, be curious, be able to change perspective, and also they would need some project management skills. Skills to develop motivation, skills to develop knowledge, creativity, courage also, and competencies to engage with people more and use an open method to elaborate training and support processes. So the professionals we worked with identified 2 different types of competencies they would need to support co-creation in their own communities. So the first set are competencies related to the process of development of co-creation in the community. It's monitoring, impact assessment, and dissemination. And a second set, which refers to personal competencies. Regarding the first type of competencies, in all countries, the following main competencies necessary were to be critical, to be able to apply processes of co-creation in the early stages of the process, to identify needs, collective problem formulation, apply resources, etc. Also to be able to adapt existing methods or methods they use to promote co-creative processes, to be able to create different types of collaboration from what they're used to, and to be able to implicate and engage with end users or citizens or stakeholders, whatever we want to call them, from the start, the very start of the process. And the last one would be to apply methods and techniques to measure the impact and the added value of co-creation. The second type of competencies identified by these professionals were more personal competencies relating to promoting open dialogues, friendliness, empathy, confidence, embracing differences, being open to the opinion of others, active listening, also competencies such as creativity, learning to push the limits, to be surprised, to be to take risks also sometimes, and dare to do something different. So the competencies to reflect individual and collective practices to facilitate the definition of the process were also very important for the professionals. So in the project, we identified some areas for learning if we wanted to promote co-creation in communities and train professionals to support co-creation processes. So this is the roadmap we designed as 5 areas of learning that they would need to promote co-creation, and they would need some knowledge about citizen power and control approaches, also about what processes and facilitators you would have to overcome and use, how to adapt your existing methods, also different types of collaboration and methods to engage with people and in higher modes of collaboration. So, and I'm almost at the end. What next? Well, of course, training and testing of the training that we put together within the project of co-creating welfare, and trying to develop those co-creation processes more. And of course, more research, and especially more research on the benefits of co-creation. What does it actually bring to the table, and how to evaluate such benefits? I just want to put out 3 points for discussion, if I may. The first one would be about, do we really have to co-create? Is it a fashion? Should we really do it? Is it a remedy to all problems? The second point about how can we practice what we preach as researchers? How can we engage in more participatory approaches to research and not only practice? And also what to do with the decision-making power. Is it something that's easy to change? How can we do it? So just as a conclusion, I would say that co-creation is a concept that requires more work, and it's as it's key in health promotion. It's a key as a promoter of success, but also a key as a common difficulty experienced in practice. So both negative and positive conceptions of co-creation need to be taken into account. And one of the most important features expressed by professionals in the strong root of co-creation is the strong root of co-creation in humanistic values. And specific competencies are needed to promote such process, and we do need more research on that topics. Thank you.
Thank you, Emily. It was a very interesting overview with all these difficulties that we are handling with. And I have here 2 groups of questions that, if you don't mind, I'm going to ask you. The first is related to your first study. That you refer to the professionals, you question the professionals, and the questions are, what kind of professionals did you address to? Where were they working? How did you contact them? How did you put them together? And how many they were, and in this group also what you did some workshops, and the question is, did you work with all of them in the same sessions or in groups, separate groups? This is a set of questions. The second set of questions is what was the innovation that you were looking at, that you were trying to achieve? I mean, what target did you define at the beginning? Some goals, a target thing? How did you did this work to produce an innovation in the process of co-creation? I don't know whether I made myself clear. So 2 groups of questions.
Yeah.
If you could
Yeah,
just
yeah.
briefly.
I'll answer to the first group of questions. The people involved in the research were all people who had or were having currently an interest in health promotion. Some of them were school-based, others not necessarily. So we had, for example, school nurses, we had teachers, we had nurses, hospital nurses, community workers, we had social workers. Did we have doctors? No, I don't think so. And of course, the invitation was. They were invited to participate on a voluntary basis, and we had 3 different groups. We couldn't have them all together, and in total we had 46 people work in 3 groups. So three groups of, say, between 15 and 20 people. I think that's probably all of your first set of questions. But the second question, I'm not sure I understand the innovation. Can you rephrase that, Graça?
Yeah, sorry. Yes, it's also my English, maybe. So you were working in co-creation, in a co-creation way, in a process of co-creation, to develop some innovation, to have, as far as I understood, to get something new. You mentioned that, I think. And my question is, this innovation that you got at the end, was it thought, did you think about the goal, the target, the new thing you want to create, or did it start when people were working together? You see what I mean? Did they find a need, something to solve the problem? Did they, during the session or before you invite them, you had an idea about the problem, that there is a problem, we have to solve this problem, so come and join me and we work together to solve the problem.
No.
You see what I mean?
Yeah. No.
If you could explain that better, maybe it will help to understand the co-creation process.
Yes. No. The problem is solved by the group when the group is formed. It's really the process. I'm talking about now the process that we used for the co-creating welfare project. You don't come with the problem necessarily and say, this is the problem, we need to solve it. Not in this case. In this case, the group identified their own problem, the problem they wanted to solve. So we didn't have any preconception of what was going to happen during the workshops and what kind of problem they were going to were going to solve. And actually, that was a problem within one group, because one of the persons came with her own problem that she wanted to solve, and she couldn't understand the fact that it was all about the collective knowledge and the collective formulation of the problem, and that the process was going to include everybody's view and everybody's understanding of the situation, everybody's formulation of what the problem may be. And it was difficult for her to go into that process of collecting collective problem formulation. So it's, I guess it's one of the issues that would probably need more research, and we could focus on that. How to, as a professional, support this process of collective problem formulation, which comes from the people. So what is your attitude as a professional and expert professional, or at least as we're used to being in our professional practice? So what kind of competencies do you need to support that process of problems coming from the people and being addressed by the people with your mediating competencies? And this is something that we also identified in the project, that really the professionals supporting the co-creation process would have to act as facilitators, mediators, rather than experts who would have all the answers and solutions to a problem in the community.
Yes. So it comes to me now with your answer. Okay, you answered the question, but now it came another question that will help also people to understand the co-creation process. And the question is it always necessary to have a defined problem before the people get together, or the people get together and then they decide the problem? You see what I mean?
Yeah.
Is there a rule, a kind of rule for the co-creation process, or it depends on the situation?
Yeah, I would say it depends on the situation. And if I can give examples from the different countries who participated in the process, in the project, we all, I think, used different ways of collaborating with the community. In this respect, I would say that co-creation is a support. It's not an end, meaning that you could come with a problem that you would, an idea at least, or maybe a focus that you would like to work with, and then decide with the group what exactly the stakes, the ins and outs of the situation are, etc. But I would say that to me, it would have to come from the group, because as an external member, if this is who you are in the group, then you don't know what the problem is. That's one of the foundations, it's the people know exactly what they need, and that they know what the problem is. They have the expertise, and as a professional, you're there to support the process of collective formulation. However, it's difficult to say a straight up no, because we as professionals, researchers, are also members of the community. So you can also have a say in the problem formulation and taking part in this process, because you have different caps, of researcher, parent, community member, and so that's why it's difficult to say either yes or no. But I think it's more a question of remembering that it's basically aimed at addressing actual needs which are formulated based on the expertise of the people who are concerned with the needs, and not an outside expert or professional who would come from outside the community to give a solution.
Yes. Okay. So to make things more clear, if you agree what I'm saying, just to confirm, in the co-creation, so co-creation is a process, is a method, is a tool to solve a problem, and it is not the how to say, the ender, the final, the outcome, the result of the action. The co-creation is the process itself. And it is those people that are working in the given situation. It can be in a school, in health promotion, or in teaching, that they can with their needs, their difficulties, and then they meet together to try to solve the problem. And for that, there are some steps in the co-creation process to do that. Is it so? Was I correct?
Yes, you are correct. You are correct.
So I passed in the exam. Thank you.
Yeah.
Okay, Emily, I think we have to close the session. I suppose it is 7. Sorry, I was looking at my time.
Yes.
For you, it is almost 8 o'clock.
8 o'clock in the evening, yes.
Yes. And for me, 7. In Brazil, it is almost 5 o'clock. So I think we can finish. Do you want to say something else just to close the session?
Yeah, just that I was very happy to join, and thanks a lot for the invitation. I was again very happy to discuss this with you, Graça. And just to close this, I just think co-creation at the moment, we're starting to work with it. Lots of people have been working over the years in health promotion. I would say it's fairly new, but I think it's really worth working on. And, to me, it's all about redistributing power and empowering people to find their own solutions. So that's what I would say.
Thank you, Emily. Thank you very much for coming to this Congress, and see you sometime, somewhere, in some place.
Yes.
Bye-bye.
Soon,
then.
hopefully.
Yeah.
Thank you.
Take care of your health.
Yes, you too.